In this video, I'd like to go over a condition called posterior vitreous detachment. This is a very common condition that we as eye specialists see on call. It may be one of the most common things that we see. And I'm just going to highlight who typically has this condition. Well, believe it or not, everybody will eventually get this condition. I often see it in patients between the age of 58 and 62. Now, of course, there's exceptions. Some people will get it in their 40s, some people will get it in their 70s and 80s, but everybody will get it if they live long enough. Now, what is it and what do we do about it? Well, the best way to understand this condition is I like to use analogies. And so I want you to think of posterior vitreous detachment, which is PVD, as very similar to getting white hair. Okay, now why do I like to use this analogy? Well, people typically start to get white hair, in that age range that I mentioned, sometimes after 50, but let's just say between 58 and 62. This condition, again, typically around the same age range. And the other reason why I like to pair them together is because having white hair is considered benign or nothing of concern. Well, typically with PVD, it's the same thing. It's considered benign. And these two things have to happen. So like I said, if you live long enough, over 58, you're going to develop white hair, and you're also going to have this condition called a PVD. And just like with white hair, we typically don't have to get concerned about it, obviously. With a PVD, it's the same thing. Now, patients with a PVD will come to the Emerge often. They'll often see the Emerge doc, or they'll see their optometrist, and they'll complain of two most commonly reported symptoms, which is flashing lights, or floaters. And the floaters is often less than 5. Sometimes it's just a single floater or a cobweb. But in some instances, it can be hundreds of floaters. Okay, and we'll get back to that. So it's often sudden, and it's usually only one eye. It's typically not both eyes. If you're getting flashing lights in both eyes or floaters in both eyes at the same exact time, it's often not a PVD. Okay. Now, a PVD, let's try and, I'm going to basically illustrate. This is the cross-section of your eye. And here's the cornea. Here's the lens. We've got some special structures here. I'm just going to highlight the main key structures, okay? So remember, a PVD, the P means posterior. Posterior means the back of the eye. So it deals with this part of the eye, okay? The V is vitreous. It refers to the gel in the eye. Well, believe it or not, in the back of your eye, you've got gel. It's called vitreous. Now, between the age of 0 to, let's say, 58, I'm just using that as an arbitrary number, the gel in the back of your eye is stationary. It doesn't move around. Well, after this age range, or after this age, I should say, once you start to get a PVD, it just basically means that the gel in the back of the eye is going through what I call a dance. It starts to move around. It's moving in the back of your eye. And this layer here is your retina, this very sensitive camera film layer, and it's right next to the gel. Now, the gel will move around and swirl around, and that's when you'll start to get the flashing lights and the floaters. So the floaters and the flashing lights. And that's what a PVD is. It means posterior vitreous and detachment, not a retinal detachment, but a vitreous detachment. It means that the jelly, because it's starting to move around, it's detaching from the retina. At birth, the gel and the retina are adherent together. And once you go through a PVD, the gel and the retina will go their separate ways. Now, as I said, it's normal for your eye to go through a PVD. The gel will start swirling around and eventually will settle down after a few weeks. But during that time, you will continue to have floaters and flashing lights. But why do we still recommend a dilated eye exam? Because sometimes, not commonly, as you might imagine, the gel does not have a mind of its own. It's just moving around, swirling around in the back of your eye. Sometimes it accidentally grabs onto your retina and pulls on it and creates something called a retinal tear. Okay, a retinal tear, and that can be in in any location of your retina. Now, if that were to happen, that is technically somewhat of an ocular emergency. That's something that needs to be treated and lasered, okay? So how do you know if the gel has torn your retina? Well, you won't be able to know. That's why you need to go and get a dilated eye exam. Now, typically, if you're going to get a retinal tear, usually the patients will complain of hundreds of floaters, but not always, but typically lots of floaters. So that's why you should always get a dilated eye exam. But in the majority of the cases, well over 90% of the time, the gel swirls around and does not make any contact with your retina. And so what I typically do is I will see the patients. If I see a PVD and no retinal tears, then I will follow the patient up, either me seeing the patient again in about a month or having them see their local optometrist for a quick checkup, because this is a dynamic process. I always tell patients, if your exam today is normal and I don't see, and the gel's moving around and the retina hasn't been torn, it doesn't mean that, in 2 days or a week from now that the gel might inadvertently pull anterior retina. So the key point on discharge is to tell the patients, you've got a PVD. However, if you start to notice more floaters, more flashing lights, or even a black shadow, a fixed black shadow, then that's a reason to go back to the emerge the same day, because it signifies the gel, which is mobile, has pulled on your retina and resulted in a retinal tear. So that's basically kind of a summary of what a PVD is, or a posterior vitreous detachment. Again, the white hair analogy is very similar because it is generally a benign condition. It is is a normal thing that we all go through, and I hope you found this discussion to be useful to you. Thanks for watching.